So can you talk a little bit about this partnership with the Houston Health Department then? Let's just start with the partnership. Why did this come about, and what exactly do you hope to achieve?
Absolutely. So we received funding from the National Institute of Minority Health and Health Disparities to sort of think through how can we engage our local communities to think through vaccine hesitancy, in addition to helping them to actually complete the vaccine series, because oftentimes, there's the second shot, there's a booster shot, and so forth. And so we decided that a good partner would be the Houston Health Department, in part so that we can collaborate with initiatives that are already happening within a city while adding our lens from a research standpoint to think through how do we engage communities that often fall through the cracks when it comes to sort of our public health initiatives and ensure that they're front and center given the differential risks that they face through COVID-19.
Is the Houston Health Department, and this might be a question for them, but I'm assuming you know, are they going into communities with mobile units to give out booster shots? I know that was a big emphasis with Harris County Public Health and the Houston Health Department when vaccines first came out. Are they doing that with booster shots now, or is that part of what you are hoping will happen?
They actually are, and in addition to that, even going door to door, finding spots where they can collaborate with faith-based organizations, community-based organizations to sort of open the doors up to sort of get folks there so that they can bring the vaccines to the community. And in part, this is a strategy to help mitigate challenges with regards to travel and accessibility.
How big of a help was that when vaccines first came out? Do you think that whatever percentage of people of color and people who come from underserved communities are vaccinated, do you think that that percentage is higher than it would have been if the Houston Health Department was not doing that?
It absolutely would be higher, and in part because of two things. One, people want face-to-face engagement so they can ask questions and be able to feel comfortable about what decisions that they want to make. And then oftentimes, our COVID approach has been very centered on practitioners, so you go to your primary care physician and that person can engage you about getting vaccinated. But what happens if you don't have a primary care physician? And so you're going to miss a whole lot of people through just leveraging hospital settings to do this work. And so going into the community gives the face-to-face engagement, and it also eliminates the challenges of signing up for stuff, having the technology and the wherewithal to either hold on long lines to get an appointment or to find the right place to, sign up online. And I think these approaches eliminate those types of barriers that we've taken for granted in many instances.
The technology thing, that's always been interesting to me, that there's been a focus on getting more broadband, when it comes to underserved communities in schools. Is that a top reason in your mind why it appears that there is vaccine hesitancy amongst these communities that we're talking about?
So I would say technology doesn't necessarily contribute to the hesitancy, but it does contribute to the lack of access and the difficulty getting appointments. Because many, for the most part, you need an appointment to get testing. You need an appointment to get a vaccine administered. And so when it's technology centered, that's where those barriers come into play.
What are you hearing as some of the big reasons why there is vaccine hesitancy?
So I think there's a range of issues. One is you have sort of a history of medical mistrust, and I think it's important to highlight that mistrust is beyond the Tuskegee experiment, because that's the one that's always thrown out there as a legacy challenge within the African American community. But then you have personal experiences with the healthcare sort of enterprise, whether it's long lines, can't get seen, uninsured, and so forth, not treated well, getting subpar medications, getting bad advice. All those things are personal experiences that spread throughout the community. And then specific to COVID-19, you have just the strong wish for it to not be politicized, in addition to getting a lot of information corrected through disinformation and misinformation, because you have sort of the initial Operation Warp Speed. When people hear warp speed, they're worried, oh my goodness, we did this very quickly, maybe we skipped some steps. And so just that label, creates challenges. When you think about the Omicron, we talk about it as being very minor or mild, and there's nothing mild about it. And so it creates this false sense that, oh, this isn't dangerous like the other versions. And then you have questions about the actual technology. Was this something that just happened overnight, or is this something that we truly understand? Does this turn off at some point? Is there any long-term consequences to an mRNA, RNA vaccination? Why do I need so many shots? Why do I need a booster on top of these shots? Am I going to get boosters every year? So just some very, basic questions like, even, does this protect me from infection, or just the transmission, or just the severity of the symptoms? There's just a lot of communication challenges that have created confusion that make people hesitant to want to take that chance in taking a shot.
Did you notice trust dwindling away also when the J&J vaccine started to be questioned when it came to blood clot issues? Like, was there a noticeable change after all of that came out? Because that's what mobile units were taking into underserved communities, right? Was the J&J vaccine, because it was one shot, or it was advertised, I guess, to be one shot, a one and done shot. And then all of a sudden, it comes out that this one is being flagged with blood clot issues. And my first thought when that happened was, oh my goodness, this is the one that was being taken into these communities. This will only add on to the distrust that, may naturally be coming about because of the Tuskegee stuff that you just mentioned. Did you notice any shift when those warnings about the J&J shot started coming out?
Yeah, and I feel like it's unfortunate because the J&J shot was the one that many people of color actually felt comfortable with, because it was just one shot. It was a technology that they were used to, and people felt comfortable about it. But the issue is, again, a communication challenge, in that, why couldn't we have talked about the blood clot challenges as being something that shows that the scientific process is actually working? Meaning, when warning signs came up, they hit the pause button, they looked at the data to see how safe is this given this new information, and made a decision based on the data that this was fine to move forward with. Unfortunately, people who are not actively knowledgeable about the scientific process saw this as a red flag and not as the process actually working. And so again, I think this is one of those examples where communication really failed and created more barriers than was necessary.
I know communication was a major issue, specifically with Houston's Latino and Latina populations. I remember early on talking to the Houston Health Department, they were hiring bilingual contact tracers, for example, simply to just you're talking about communication in terms of the message delivered by public health officials through the media, but just that basic form of communication with the Latina population here in Houston was troublesome early on. I know that does your partnership with the Houston Health Department address Latina, or are we just talking about the Black population here in Houston?
It does address the Latinx community as well, all underserved communities. And I think when it comes to sort of folks of, international populations, Latinx communities, I think language is an extremely huge barrier. And if you want to engage them, you have to be able to do it in their preferred language. And so when you see a lot of the work that's happening in the Houston Health Department, a lot of the work that we're doing in our Health Center for Addictions Research and Cancer Prevention, we try to make sure that anything we disseminate is disseminated in multiple languages so that people can not only see themselves represented in the imaging and in the sort of the design of what we're doing, but also in the word choice and the cultural frameworks that are being displayed as well.
For sure. Just a couple more questions. Can you kind of outline just short-term goals versus long-term goals with this grant money and the partnership with the Houston Health Department?
So I think the short-term goal is to truly do a reset and really listen to the community to kind of understand why they're truly hesitant, and not just project onto them what has been historically believed to be the challenges within various communities. And so this represents an opportunity for us to do focus groups, to go and do town hall meetings, and then sort of based on that information to get a sense of what are the sources of disinformation and misinformation, creating micro videos that really debunk some of the challenges that people are afraid of, and then sort of come up with a framework and a data-driven approach to how we could mitigate these things moving forward, such that when the next big health challenge takes place, we know how to immediately communicate about it and intervene and mitigate whatever the challenges might be, so that we're not in the same boat, the next time. And so, we're in Houston, a very diverse community. We see these things happening every time there's a national or regional sort of disaster. When you think about Harvey, you think about the big freeze. It's the same communities that continue to have a disproportionate burden as it relates to the damage that happens from these experiences. And so knowing this, we want to truly come up with a framework to where service providers, elected officials could do a better job moving forward.
It sounds like a monumental challenge, though, when you're talking about battling disinformation, because there's disinformation online. That's one thing, but from what you're saying, the disinformation, the access to online is limited anyway when we're talking about this specific population when it comes to booking appointments for tests, booking appointments for vaccine. That's a challenge. Do you see the disinformation challenge? Is it with this specific population, is it more of a word of mouth challenge, compared to an online challenge when it comes to disinformation? And how do you, separate those two when it comes to forming strategies to combat the disinformation problem?
Yeah, I actually think it's a generational challenge. It's a technology challenge. It's very complicated, meaning that you might have younger generations that are on Twitter, Facebook, Instagram, getting this stuff in real time and then feeding that information to their parents or grandparents, and then through word of mouth, it then spreads even more rapidly. And I feel like the big challenge right now is just gaining trust, and allowing the community to be part of the process. If they're part of the process, they have greater trust in what's happening. They have a voice in what's happening. They could, say, hey, we've tried this. This doesn't work. Have you considered this? And having them as equitable partners in the process, we have found, allows us to rapidly disseminate what needs to happen, because they're now part of the team and not objectified as this external entity that we want to bring, all this scientific knowledge to. And so if we put them as part of the process, we also here's the challenge in communication. Here's where we need to start. Here's the people we need to get at the table. And I feel like that approach is not happening at the national level. And that has been the reason why we've been able to make a greater impact, is because we actually have community members as part of our stakeholder team.
Just one more question. Sorry, I know I keep saying just one more, but these
It's fine.
but correct me if I'm wrong. Have there been town halls in these communities at all? Has the county set anything up? The Houston Health Department? I kind of remember that it happening maybe on a very small scale, but has it happened? And if it has, what has the participation been like? I know you want to expand it, more community engagement, more town halls, stuff like that. But of what's been done, how much participation has there been?
So I can't really speak to that part, because I feel like most of the town halls that I'm aware of has been virtual.
Uh-huh. Yeah.
And in part because of, COVID is
Right.
circulating
Yeah.
everywhere. But what we're trying to do is sort of a hybrid of it, to where we can find large spaces where we can socially distance individuals and have the right stakeholders in these town halls to sort of be able to have that real engagement. And then from those town halls, sort of highlight what are the big take-home points that we want to make sure is more broadly disseminated. And then we create these micro videos. And so we've been doing these things that we call webisodes, where they're only maybe 5 to 10 minute video clips that really go into a very specific topic area. Mm-hmm. And so that's going to be how we're trying to navigate both face-to-face engagement and the bigger dissemination across a broader stakeholder group.
And when do you plan on starting this? Because, we're in the middle of a surge right now. We're talking about a population of people that's unvaccinated. So, putting all these people in one place is, might not be the safest, option. Are we thinking, maybe in February, March to start this? Look at what happened with the Omicron surge. Look at what happened with the Delta. And then is that the idea? Maybe start it in a couple of weeks or something like that.
So right now, we're actually engaging super neighborhoods in the ways in which they are already communicating with one another. So an example of that is next week, we're going to visit one of the super neighborhood meetings and sort of provide presentation and information in that forum. And then based on that engagement, we then have follow-up conversations around what's a safe way in which we could bring more people to the conversation and go from there. 9 times out of 10, it might be a local community-based organization that can house it. Because, obviously we can bring folks to campus, but people may not want to come to campus from a community engagement standpoint. And so we're really going to keep that same spirit of begin finding stakeholders who are motivated in this topic area and allow them to sort of help us, collaboratively come up with strategies that maximize how we can reach the most amount of people in the most effective way and also in ways that make sense to them from a cultural standpoint.
Well, we can help out with that in terms of promoting this. So you said next Saturday, where is this super community? Where is that taking place? Because I'm thinking just based off what you just said, we'll release the story kind of just ahead of time, ahead of that, maybe get some people over there.
Yeah, so I think our meeting next week is going to be on Thursday, and that will be part of in Acre Homes.
Acres Homes, okay. And will people need to sign up for that, or can they just walk in?
I think this one is a virtual invitation scenario because it's a meeting with their super neighborhood leadership.
Gotcha. Okay.
But when we get into a place where we're ready to have the more public forums, we could absolutely love to, get that information to you all, to get the information out, and maybe even to do a follow-up of how it went and things of that nature.
Oh, absolutely. I definitely want to continue following this because I've just been, this story hits on just something I've been thinking about I've been covering the pandemic since the very beginning, and this is just how to reach this population. It's just interesting, and there's obviously justifiable reasons here to distrust. I just think it's an interesting situation to follow. So yes, definitely. I would love to continue talking with you about how it's going. Is there anything else that you want to say at this point? We'll get a story out about this next week.
Yeah, and I think probably one thing that I would sort of say is people in the community like to hear experiential examples that aren't always the cleanest.
Mm-hmm.
And what I mean by that is oftentimes doctors will come in and say, this thing is safe, you should take it, it protects you and your family, and blah, 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 blah. But that doesn't resonate with folks who are actually struggling. And so oftentimes I might share with, hey, I too was vaccine hesitant. I too have the same questions you have.
Mm-hmm.
This is what I did from my process to try to work through some of it, some still unanswered.
Mm-hmm.
And I needed to figure out, well, how do I balance, my risk versus the safety component? And then I began to talk to my family members, and they would tell me, well, if you're not taking it, why would I take it? And so on some level, I had to take that leap of faith to say, you know what, I can model this, I can demonstrate that it's safe, I could share this story, and then people can resonate with that. And I just truly feel like, this is a deadly virus that can be controlled and ultimately eliminated if we could just figure out a way to get on the same team, have a similar communication, and just work together to protect ourselves. Because just allowing this virus to circulate is only going to create more mutations, and it's only going to keep us here in this space much, much longer.
Is part of the education going to be explaining the difference between individual health and public health? I've had to do this. I found myself doing this more and more in my own personal life, just because I've learned so much over the past 2 years, just how distinct that difference is? Is that what, like, okay, I'm getting the vaccine really not for me,
Right.
I'm getting it for other people just so we don't have a hospital crisis and we don't have the residual effects of emergency departments shutting down. We don't have elective procedures, getting canceled. Is that going to be part of this? Because I think that has, even at this point, who I considered to be people in my own newsroom. I had an editor literally last month before the Omicron surge kind of came up, ask me that question. What is the difference between public health and individual health? Like, what are you talking about? When you break it down, I think it is easier for people to understand. Is that going to be part of this, that education?
Absolutely. And I think also framing it in a way that makes sense culturally. So when you're talking to collectivistic communities, it's easier for them to see how if I do this, this affects the whole family, this affects the whole community. And I think that's important for people to be able to see that component, that it's bigger than just you. And then if you think about it from even an individualistic standpoint, you know, sometimes people just want to do their part. What can I do in order to help everyone get out of this situation? And I think from the, distinguishing public health, versus individual stuff, the public health approach has gotten such bad sort of a bad rap because of the politics associated with it.
Mm-hmm.
Oftentimes people say, this is my right, this is my right, this is my right. But there are so many things that we do that we don't have a choice with, like wearing a seatbelt,
Mm-hmm.
having a passport to go outside the country, to be vaccinated, to go to school. There are many things that we do that have a public health approach towards it that we don't question because it's not as politicized. And I think being able to show folks that here's the vision of what we're trying to do from a population standpoint, and then here's how this affects you and your household,
Mm-hmm.
and can accelerate how you could get back to doing those activities that you once loved doing in a safer way.
I have so many questions for you. I don't want to waste your time, though. Do you think public health has always been undervalued, but it's just kind of been put, the highlight marker has just been put on it because of COVID? Like I'm talking about in terms of funding from the government. I'm talking about in terms of people's priorities, messages through the media. Like, this isn't a new problem, right? Undervaluing public health.
I think public health, I think mental health, these are many things that have been stigmatized, under-resourced, and difficult to roll out because then you have to navigate the complexity of how we operate through state legislation, through federal legislation, and so forth. And it's really difficult to get everyone who has different lived experiences on the same page on some of these topics.
For sure. All right, Doctor. Well, I don't want to take up any more of your time. So thank you very much. And if you can get that data to me, that would be great. That would definitely help the story. Just what percentage of the 30% are coming from underserved communities, people of color, the percentage in the hospital. I think that can kind of help highlight the issue here. So that would be great. Thank you very much for your time. Love talking with you.
Sounds good. When do you need it by?
So I have a couple more interviews. I'm going to talk to people, actual people who've had vaccine hesitancy. Those interviews are next week. If we can get it end of day today, that'd be great. But I mean, the story's probably not going to go until Wednesday or Thursday. So, we can do it next week if you want.
Okay. How about Saturday at the latest?
Oh, that's perfect. That sounds great. Yeah.
And then if you could let me know where I can email it to you.
Sure. Are you on Microsoft Teams? That was, I was told by Allison that you're on Teams. Yeah. Let me send you a message. I think this is you. How do you say your first name again?
It's Ezemenari.
Okay. I'm sending you a message right now on Teams. Just let me know if you get it.
Got it.
Okay, cool. Yeah, you can just send it to me right on Teams. That'd be great.
Okay, sounds good.
Thank you so much.
All righty, you take care.
You too. Bye.
Bye-bye.